So I'll begin with the introduction. So I'm a Brazilian dermatologist based in São Paulo, and I'll talk about the hormones for gender-affirming therapy and hair restoration surgery. So I'll begin by a glossary. So cisgender is someone who identifies with the gender they were assigned at birth, while transgender are individuals with psychological and emotional identification with the opposite sex at birth. So a woman that identifies as a man is a male transgender, and a man that identifies as a woman is a female transgender or trans woman. According to the last census in Brazil, we estimate that we have 4 million transgenders. In the US, 1.6 million transgender. So it's a lot of people that can't be ignored. I'd like also to begin in this glossary with this non-binary term. What does non-binary mean? It's a person who doesn't identify with either the male or female gender. And remember that gender identity is different from sexual orientation. And a transgender can be binary or non-binary. I know it's complicated, but with this Gen Z, Gen Alpha coming, we'll see way more often this flag from the non-binary gender, and this is the signal for non-binary. So transgender, until 2018, they were considered a gender disorder, and only after that, and today they're considered a gender incongruence. In general, transgender are socially marginalized. 57% are Black, with low life expectancy of around 25 years, and in general, low level of education. So it's a huge number of people that need healthcare assistance. 88% of them take hormones. That's called gender-affirming therapy. So what's the hormone treatment for male transgender? It's testosterone, either topical, in gel, or intramuscular, or subcutaneous, or in patches. And in a study that made this follow-up of 6 years with young patients from 23 to 32 years old, the trans male, they had 2.5 more times chance of developing androgenetic alopecia than cis woman. And up to 63% development of androgenetic alopecia when using testosterone. And when does it happen? Because we can think about our male patients also taking testosterone, and much of them, they say, I don't see a difference in my hair. It won't make any bad to my hair. But you can take up to 2 years to start seeing the bad effect on your hair due to testosterone. It's not very often that we see trans male patients at our office because they believe that being bald can further promote the masculine appearance. But they do perform facial hair restoration. And what's the perfect timing for beard hair restoration? Dr. Stephen Gable will talk about this in his talk. But for instance, we know that testosterone can improve the hair follicle diameter even after 1 year of treatment. So we should wait for at least 1 year after hormone therapy for the beard hair transplant. So there's also body hair restoration in a trans male, just like in this case, and female trans or trans woman. They are a unique population to benefit from hair restoration. While for them, gender-affirming therapy is protective or has a neutral effect on androgenetic alopecia. There is still a few data, but cases relate that it can even improve or at least stabilize androgenetic alopecia. So they desire a female hairline. And Dr. Nilofer Farjo will talk about the design of a female hairline for transgender patients. And let's talk about the hormone treatment for female trans. They take estrogen in order to decrease testosterone and increase estradiol, anti-androgens like spironolactone to inhibit the testosterone effects, GnRH antagonists to total block testosterone, and progesterone in order to breast growth. These are the hairs that are affected due to hormone treatment. What about the surgical planning for trans women? So the front line should frame the face, and the temples, they need a large number of grafts. Either FUT or FUE can be performed according to the patients. Some of them during this period of like transition, they still have short hair, and then we can perform FUE. For long hair, FUT. And this, for instance, is a surgical planning of a patient 3 months before, and the final result after 1 year. This patient, for instance, didn't want to perform the hormonal therapy. So we did this FUE technique, maintaining the previous line in order to make like a more fluid design. The immediate post-op, 15 days after, and 6 months follow-up, and now he's letting his hair grow. There is this article that classifies the types of hair loss in transgender patients. And also the facial feminization surgery can help a lot. According to the type of hair loss in this female transgender patients, you can program 1 to 2 surgeries, and we should also be conservative, especially in type 4, 5. Here, examples of facial feminization surgery together with hair restoration surgery, and you can see how like the face changes, and that's impressive. Here, another example, and we have Dr. Mark that will talk about this in his talk, his lecture. And I should remember also that the design of the eyebrow also changes. There's hair restoration for a female eyebrow design or male eyebrow design. As a final message, I'd like to say that we should be familiar with the correct terms, the pronouns, appropriate gender, the social name, how the patient will be called. And the anterior hairline plays a crucial role in the upper third of the face. And we should, as doctors and healthcare professions, take as a privilege that we are a part of this gender affirmation therapy. There are still a few challenges that we're going to discuss today, like when's the right time to carry out the procedure? Should we make like a more feminine design or a design that just fits the face, more fluid, no binary? And these patients should also be under multidisciplinary care to endocrinologists, psychologists, therapists. And this is one article published on this subject. And I'd like to finish with this special gift that I got from a transgender patient. That's her new birth certificate with her new name, and now it's written female. And she thanks for the attention and wishes that more healthcare professionals are willing to take care of them. Thank you. So